Hi, everyone, and welcome to this Consensus for Change Roundtable event. I'm Dr. Jennifer Barth, Research Director at Smooth Media, and I was the lead researcher on the report. We're here today to discuss the results of one of the first global studies of how the pandemic has changed expectations for safety and created a heightened awareness of the need for technology and accelerating innovation. Conducted by Dr. Chris Brauer at Goldsmiths, University of London, the study included a survey of 12,000 citizens, as well as interviews with over 50 public safety agencies, commercial organizations, and experts across 10 markets. I'm just going to briefly touch on the top line findings from the report. 88% of citizens globally now want to see public safety transformed through the use of advanced technology. 71% say advanced technologies are needed to address the challenges of the modern world. 70% say emergency services should be able to predict risk, and 75% are willing to trust organizations that hold their information so long as they use it appropriately. The research data revealed 3 defining trends that emerged and connect public opinion to the use of safety technology. They are that expectations for safety have been redefined through the pandemic. Innovation by public safety agencies and enterprises is accelerating, and the need for trust and transparency is growing. We're more than a year and a half into the pandemic, and it has completely changed how we think about safety and those responsible for providing it. How have you seen stakeholder, public or patient, employees, etc., attitudes shift since the onset of the pandemic, generally or even within your organizations? Mahesh, could I start with you?
Sure, Jennifer. As with any crisis, we tend to redefine what we consider to be normal. We tend to recalibrate what our perspectives are on technology, on policy, et cetera. And this pandemic has really been no different. And I think the public perception on what is acceptable use of technology, skepticism, et cetera, have been reevaluated in many different ways. I think society as a whole has asked the question, in light of significant challenges in front of us, what are the facts? What are the data that are necessary for us to look at things, not with a degree of skepticism, but with a degree of opportunity that it presents to solve the problem and to make us safer as a whole? As a technology organization, we have had to revisit the way we do things, whether it is trying to do it faster, but also more importantly, to do it with a wider set of stakeholders at the table, beyond just engineers, beyond just those who build product, but the community at large, and really incorporating their feedback, their thought processes, to have a diversity of opinion, a diversity of thought, to make sure what we're doing is not only a solution to the problem, that solution is brought together quickly and in a way that is useful, but it is also one that the community accepts, understands, and really finds useful.
The pandemic has underscored some issues that existed prior to the pandemic, but somehow put them on steroids, made them more real, if you will. And also, I think it opened individuals' minds to alternative ways of doing business. And I'll just speak to both of those for a moment. Prior to the pandemic, we were in a situation of having staffing shortages in 911 centers across the country. So I think that was the first thing that we've noticed during the pandemic. The second aspect of this is the disparity between the others in the public safety services compared with those in 911. Most importantly is the emphasis on technology and the changes that are occurring. In Europe, in Austria, the opportunity to provide 112 services remotely from their homes has been available for years. And now they're kind of the model of how to deal with remote employees. And here in the States, we've had that same opportunity with the ability of technology and cloud technology that we are capable of enabling individuals to work remotely in the provision of 911 services. So I am very optimistic about what this pandemic has taught us and shifts in thinking as we approach technology, as we approach the 911 professional, him or herself. And I think there are incredible, valuable lessons to learn as we have gone through this pandemic and frankly continue to go through this pandemic, looking at technology and looking at the professionalism of 911.
Yes, Brian brings up some interesting points. I have also found that while much has changed due to the pandemic, the public still has some concerns about the use of technology, and the policies and transparencies of that use is necessary to ensure the trust is still there between the community and our government agencies. But at the same time, I think it is more important than ever for law enforcement to work smarter, not harder. It's finding that balance that is the key. And our agencies are starting to understand even more that it is critical to bring the community in and show them what technologies they're using and are planning to use and how they will be used.
Mahesh, if I could direct this question to you to begin. We found in the study that the pandemic has accelerated the adoption of technology and innovation on the part of public safety agencies and enterprises. Could you speak to the areas where you're seeing the greatest acceleration?
For sure. Usually technology adoption goes through a step change when there is a fundamental shift in the perspective of how we work. And I think it starts with the definition of proximity. There was a time when physical proximity meant that we were able to work together, get our jobs done. But that notion of physical proximity has now changed to a notion of virtual proximity. It has been one where how quickly can you collaborate and communicate in order to get your job done? How quickly can you collaborate and communicate in a team so that expertise is brought to bear as quickly as it would be if you were all in the same room together? So this notion of virtualization that changes the definition of proximity, where we are close, regardless of where in the world we are, has been a key driver of the change in technology adoption, and a key factor there has been cloud. Cloud-based technologies as a way to virtualize our physical presence, but really bring us together in all meaningful ways so that we can get our jobs done. That has been a very significant change in the adoption curve for new technology, cloud very specifically. The second is, as you mentioned, Jennifer, I think it is the notion of how we have transformed the nature of use of certain technologies that may already be in place. Video is a very good example of this. Video, previously in the context of CCTV, has very much been a security-oriented thought process. How can we make sure that a malicious actor or some individual, it doesn't do anything bad in any given physical world? But that shift has gone from security to one of safety, where it is not about a single malicious actor, but it is the understanding of behaviors, the understanding of what we all are doing as a community to keep each other safe, and leveraging this notion of us being able to remotely extend our senses so that we can, in fact, keep each other safe. And that is really the notion of safety as it's applied to video, more so than it was done previously. I would say that is the second aspect of what has changed. The third is, I think the pandemic has put an increased emphasis on us being able to leverage all data available to take good decisions. And not only to take good decisions, to also potentially predict risk as it comes and be able to get ahead of problems. And critically, to enable that, we have to de-silo what has traditionally been data that have been stored within the context of applications, within the context of certain roles, really bringing them together so that collaboration not only happens at the level of people, but collaboration also happens at the level of systems and applications and processes. And so interoperability has become a big deal, and the ability to connect systems, exchange data in meaningful ways, all in the service of better decision-making, has been very critical as well.
Yeah, hospitals are their own little ecosystems, their own little cities. They're completely self-sufficient in a lot of ways, and there's a lot of challenges that come along with that. At the beginning of the pandemic, we were forced into adopting new ways of working, new ways of thinking, new types of technology in a very, very quick pace. So we were looking for ways to do more with less. And I think we've kind of adopted new technologies in different phases of this pandemic. We started out with communication and interoperable communication being one of the primary things that we had to address right at the onset as things were ramping up. So I know our hospital implemented new ways of communicating internally, not only voice communication, but video communication, some forms of offline as well. And this all got tied into our security and safety as we progressed forward. As we moved forward, though, we really ended up looking for ways to get more done with less resources. Staffing has just been painfully short throughout the pandemic from a nursing and healthcare provider standpoint. So we're looking for ways to do more with less in that regard. I know watching our visitors coming into the hospitals was something that we really wanted to focus on, making sure that we had that social distancing, that we were keeping our patients and caregivers safe, that we weren't allowing visitors in that were febrile, and how to check our screening processes. So these were areas where we started to look to technology, thermal cameras and cameras that had analytics built in. So these were certainly some of the things that we took a look at.
Catherine, can you talk a little bit about what you've seen through the pandemic and changes you've seen maybe around training and implementing new formats?
Absolutely. Because of the pandemic, we've seen the need to implement new and virtual training formats for our officers. Much of law enforcement's training is actually done in person. So we've had to become creative during the pandemic to ensure that the proper training and understanding of policies of the use of technology continue. So being able to pivot to virtual training has been challenging, but it has also provided us new ways to provide training to officers.
I also believe that in addition to the importance of technology, cloud technology has been a godsend. The ability to push and pull data from the cloud, the ability to use artificial or augmented intelligence. All of us are having to adapt using technology to best serve our public, in the case of public-facing agencies, and our staffs in the face of having to interact with the public and also with ourselves. I look at it as being very, very positive in addressing issues that the pandemic and even pre-pandemic situations have presented. In this case, 911 or public safety writ large.
Moving to the area of trust and transparency, we really saw in the research that citizens are okay and they have a sense that to get the safety that they need, and in a world of advanced technology, they need to give something. They need to give some of their data in order to get that increased safety. But of course, that comes with the desire for transparency and understanding of the way that data is being used, and a sort of fairness and inclusive way of thinking about it. And we saw both those things happening. People want increased technology use, and they want an increased and a commitment to that trust. So while the study revealed support for that technology, I think that argument around fair, transparent, and inclusive use is increasingly important. What concerns do you hear from the community related to each tech adoption, and what are some of the best practices for addressing these?
The public needs to understand the purpose behind the technology and how it serves them. So as we've struggled to combat the pandemic, we need to make sure that our caregivers feel safe coming to work. That's an entire ecosystem that we've built into our dispatch and communication suite, not only using video for early identification of threats and concerns, but other advanced technologies like gunshot detection systems and a number of other safety programs that they have. So we're trying to bring all of that together, and then we bring it into mass notification. How quickly can we notify people that there's a threat in the area? So getting some automation built into those types of systems, where if a threat is detected, how quickly can we then get the notification out? So that comes down to a human factor in training, and it comes down to a technology factor in automation. We've announced them to our caregivers and painted a use case for why we've adopted these new technologies. And it's really been met with open arms, right? Because safety is important to people. And when they come to work, they don't want to feel unsafe. So it's been met with zero resistance, adopting new safety technologies that are helping people mitigate not only our pandemic, but epidemic here in Chicago as well.
Mahesh, we need to help people understand how the technology works. Can you talk a little bit about what you think about trust and transparency?
In public safety, it has to be something where you have to have an understanding of how and when technology are used. And at the same time, you have to have an understanding where an explanation can be offered, where an output that is produced by technology is connected to the inputs in a very clear and concise way. So the explainability of outputs given certain inputs needs to be clear. It cannot be magic. And I think ultimately us educating the public, us educating our users in terms of where technology has an impact, the mechanisms that enable it, where the magic actually doesn't seem magical, it still seems incredibly useful, but not magical. I think that is the goal here, and that is what is necessary for us to inspire trust and also increase a sense of transparency.
So can technology providers develop and introduce products that buyers and communities, will embrace and understand? Is it a matter of providing better education on the topic? Is it almost a matter of providing less in a way because the details are difficult to understand when you're a non-technical person? So what are your thoughts on this, Mahesh?
I think it boils down to focus and explainability. Focus in how we apply AI and how explainable it is in how AI helps a particular focused area. I think when we think about public safety, we really boil our focus down to roughly two areas. And it all is around this notion of saving time. We've had, I think, all our panelists talk in some form or the other about the need to do more with less, understaffing being a significant issue. Where does time go today? Time goes today in roughly two areas. One, searching for information that you need to take a decision. And secondly, recording what you're doing, documentation, because compliance ends up being a big part of it. I think Martin mentioned policies and procedures being an important part of the story. So the ability to enter information is actually time consuming. And when it comes to AI, AI has to be assistive. It has to be something that really scales human potential in those ways. And really, where AI shines is the ability to find information, to actually review lots of data, to answer a question that a user might be asking. And when that user gets that answer, it is explainable because it is what they would do. It is just what they would do done faster. And similarly, when it comes to things like recording data with emergency call handling, telecommunicators can benefit from transcription where things like addresses, certain things that are said can be automatically transcribed, and that can actually make the filling out of forms much easier, much faster. It saves them time. Again, something that they visually can verify as being true. It is not magic anymore. It is just that something that really accelerates their job, their ability to do what they need to do and save lives in the process. So it is really that. It is this notion that we can engineer solutions where AI is assistive. It is not magical. It focuses on saving time, which is so precious in public safety, and really give the power of human intelligence its full potential to shine. And I think explaining that, being clear about that, and talking about the mechanisms that enable it, that is what really encourages community trust.
I wonder, Doug, what you saw as the potential of video with embedded analytics to help assess compliance, for example, in your own hospital.
Sure, Jennifer. Yeah, I think Mahesh really painted a great picture of what AI does and how it helps us drive efficiency. I think it's important to remember when we're discussing this particular topic that healthcare could not shut down at the beginning of this pandemic. We were open, we were busier than ever, and we were struggling with ways to keep social distancing in the lobbies. AI, that artificial intelligence in our surveillance system, is capable of detecting social distancing or a lack of social distancing and allow us to act on that. So instead of that one public safety individual or security guard in the lobby trying to keep an eye on everything, now our dispatchers and back end operators can kind of see those alerts that there's a group of people congregating. We, again, from a standpoint of a critical business that couldn't close, we continued to have to keep our cafeteria open, continue to feed our caregivers, our patients, and that analytics came into the cafeterias as well, not only from thermal, but the social distancing, the mask wearing. These are all things that our camera systems these days can detect and let us know when people aren't compliant with this. And compliance, of course, is more important than ever in the healthcare setting. And we've got to be careful about our vulnerable populations.
For our National Capital Region program, before any information was even shared between law enforcement agencies, a strong governance and memorandum of understanding was developed with each agency's city, county, or state council reviewing and ensuring that the MOU and information sharing policies follow their respective laws. In addition, strong policy and rules on the use of the system, what can and cannot be done with the data has to be outlined. And we did that even before any users were allowed to access the system, and then required training developed and then implemented. All of our law enforcement agencies have standard operating procedures and policies, but adding on top of that, even more detailed operational policies and rules when it comes to the use of technology is important, and even more important, regular auditing of the use of the system. That only helps to ensure the community's trust that officers will only use the data that they are given access to for law enforcement purposes and only when needed.
Interoperability is crucial. It's just simply critical. We have to have the opportunity for field responders to interoperate with those who are in the 911 centers, and hopefully those who are in the medical facilities where an individual may be transported. And so I think having that information, recognizing that these are trusted authorities, will go a long ways to ensure legislators, city councils, the general public about the safety and security of information that moves from point A to point B. So I think that's important. I also think that the ability to interoperate with each other using cloud data is also important. Utilizing cloud and interoperating with the cloud and interoperating with trusted authorities is probably more secure than data that are retained in local law enforcement or 911 centers. We've seen a litany of situations where hacking episodes have occurred at the local level.
Doug, could I follow up with you with what you spoke about? Because I want to look a bit to the future now, and I wondered how could the technology that you used in the, that the hospital used be continuously used post-pandemic? Would it help to triage patients, or other ways you're seeing it continue?
Yeah, I think we're trying to centralize more of our systems and use artificial intelligence or AI to really start keeping an eye on more things than we've ever watched before. So in our waiting rooms, the emergency department waiting room, we're utilizing it for things that people had not previously envisioned. We're now able to look for groups of people congregating. We're able to assess abnormals, right? So if somebody gets up and runs across the waiting room, that can flag out to our security dispatchers, and we can take a closer look to see what's going on. We're looking for ways, we haven't found it yet, but we're looking for ways to, I think the word we're using is telesit, which is essentially watching some of our more vulnerable patients remotely, as opposed to having that one-on-one interaction or assigning an individual one-on-one to be there with them. And again, this all comes back to just driving efficiencies in a system, a healthcare system that's otherwise very much stretched.
Doug, how have the experiences for you over the past 2 years changed how you evaluate risk and how you see going forward?
It's an interesting question. So I think we've all learned to take on a larger risk simply just by being forced into it, right? We didn't have a choice in how we handled this pandemic, and there were risks that came along with it. But now we're seeing vendors catch up with those risks that were forced upon us or thrust upon us. So now we're seeing opportunity, whereas as before we saw barriers, now we see opportunity.
I echo what my fellow panelists have already said, but I would like to add, at least for law enforcement agencies, there is help. I have served on quite a few law enforcement working groups and task forces over the last few years regarding various technology implementations. Much work has already been done by a combination of law enforcement practitioners and industry partners to create like a technology policy framework, technology guiding principles, use case catalogs, and example policies to assist agencies who are thinking about implementing these technologies. So agencies don't have to start from scratch. These are all extremely important documents that help agencies who are looking to implement new technologies in their agency. But many times they're unaware that there's a ton of work that's already been done, and they just need to know where to look. So I would suggest, agencies, for our law enforcement agencies, start looking at the International Association of Chiefs of Police, National Sheriff's Association, the IGES Institute, Department of Justice, and major city chiefs and sheriff's associations.
Brian, what do you think about the future and what we've learned from the pandemic?
First off, I'm extraordinarily optimistic about the future. I think technology will not solve every problem, but it will go a long ways to help address the issues that we've seen crop up during the pandemic. I look forward to what the future will bring as we take a look at artificial intelligence. And all of these things, I think, will go to ultimately provide better service to the public. And that's what we're all about, is providing better service to the public, and particularly in their moment of need.
Yeah, fundamentally, I think that the role of technology is to amplify human potential. That is the mission statement for, I think, every technologist across every realm of public safety. And as Doug said, I think all of us are very hopeful about the potential of artificial intelligence, but it is really artificial intelligence or technology as a whole in being able to allow service providers, public safety service providers, to really take decisions based upon as much information as they possibly can get without being overwhelmed by it. This conversion from information to knowledge is what technology and AI in particular allow. And when you think about the ability, the scale at which we can allow public safety service providers to process data, to process information, and to collaborate to solve a problem, it gives us the ability for every individual in a community to have a voice that is heard, because that voice that is heard contains valuable information. That valuable information, done the right way with technology, can actually augment the service provider's ability to provide their service, to protect the community, to help people more effectively in that moment of need, as Brian mentioned. Ultimately, where I see technology and AI really focusing on is amplifying the community intelligence. And that is where the participation comes into play. It is not as much about the artificial intelligence, but it is the assistive intelligence that helps the community become more participatory and really increase the intelligence as a whole of what can be done and what should be done to keep us safe and to really go into a new and brighter future.
Thank you again to all the panelists for joining us, and thank you for listening today. I want to just direct you to the full findings of the report, Consensus for Change, and you can find them at www.motorolasolutions.com/consensus for change. Thank you so much again.